Hi, I am Dr. Kavita. Please do watch, share, subscribe to my channel. I am regularly posting on my YouTube channel about the basics of some fundamentals of some medical subjects and topics. Please do watch, share, subscribe to my channel. Today I am going to discuss about dysfunctions of fallopian tubes and infertility in detail. Dysfunction of the fallopian tubes is a common cause of female infertility primarily because they interfere with the essential processes of egg transport, fertilization, and embryo movement into the uterus. The major dysfunctions involve blockages, inflammations, scarring, and structural abnormalities of the fallopian tubes. Key dysfunctions of the fallopian tubes linked to infertility are: first one, tubal blockage or obstruction. Blocked fallopian tubes prevent sperm from reaching the egg or fertilized egg from moving to the uterus, leading to infertility. Causes include prior infections, pelvic surgeries, endometriosis, and previous ectopic pregnancy. So, that is about tubal blockage or obstruction. Second one, salpingitis and pelvic inflammatory disease. Salpingitis is inflammation of the fallopian tubes often caused by bacterial infections like gonorrhea and chlamydia, sexually transmitted infections. Untreated pelvic inflammatory disease can cause scarring and blockage of the tubes, leading to infertility and increased risk of ectopic pregnancy. So, that is about salpingitis and pelvic inflammatory disease. Next, hydrosalpinx. This is a condition where fluid accumulates inside a fallopian tube due to blockage or infection distending the tube. Hydrosalpinx reduces fertility by impairing fertilization and embryo transport. Next, tubal adhesions and scarring. Adhesions are bands of scar tissue from infections, surgeries, ruptured appendix, or endometriosis that can distort or block the tubes, impairing their function. Next, endometriosis related tubal dysfunction. Endometrial tissue growing on or around the fallopian tubes can cause inflammation, adhesions, and blockages that impair tubal motility and ovum transport. Next, fallopian tube structural abnormalities. Congenital malformations, fibroids involving the tubes, paratubal cysts, isolated tubal torsion, that is twisting of the tube, and endosalpingiosis, presence of tubal tissue outside the tubes. What are the things? What are the fallopian tube structural abnormalities? Congenital malformations, fibroids involving the tubes, paratubal cysts, isolated tubal torsion, and endosalpingiosis. All these can contribute to infertility by disrupting the normal tubal anatomy and function. Next, past ectopic pregnancy or tubal surgery. Previous ectopic pregnancy or surgeries like tubal ligation can damage tubal structure or function, leading to infertility. So, what are the key dysfunctions of fallopian tubes linked to infertility? First one is tubal blockade or obstruction. Second one, salpingitis and pelvic inflammatory disease. Third one, hydrosalpinx. Fourth one, tubal adhesions and scarring. Fifth one, endometriosis related tubal dysfunction. Sixth one, fallopian tube structural abnormalities. Seventh one, past ectopic pregnancy or tubal surgery. So, medical students, what do you read about? What is tubal blockage or obstruction of the fallopian tubes? What is salpingitis and pelvic inflammatory disease, and how it affects the tubal function, fallopian tube function? What is hydrosalpinx? What are the fallopian tube adhesions, and what is meant by tubal scarring? How does endometriosis affect tubal dysfunction? What are the structural abnormalities associated with fallopian tube? How past ectopic pregnancy affects tubal ligation, affects tubal function and structure, leading to infertility. Next, I am going to tell you about how these dysfunctions cause infertility. It can block the passage, it can impair the motility, It can alter the tubal environment, first blocking the passage. Tubal blockages prevent sperm from reaching the egg or fertilized egg from reaching the uterus. Next is impaired motility. Damage to the tubal epithelium can impair ciliary action and muscle contractions required to move eggs and embryos. Next, altered tubal environment. Inflammation or fluid buildup, hydrosalpinx creates a hostile environment for fertilization and embryo development. So, how do these dysfunctions cause infertility? By blocking the passage, impaired motility, and altered tubal environment. How do we diagnose and detect fallopian tube dysfunction? First one, imaging tests such as hysterosalpingiography (HSG) or hysterosalpingo contrast ultrasonography assess the tubal patency. Second one, laparoscopy with chromopertubation is used when more detailed evaluation is needed. Symptoms may be absent but can include pelvic pain, irregular menstruation, or history of pelvic infections. So, we can diagnose the fallopian tube dysfunction with the help of symptoms also. So, how do we diagnose them? Through imaging tests like hysterosalpingiography, hysterosalpingo contrast ultrasonography, and laparoscopy with chromopertubation. What are the treatment options in fallopian tube dysfunction? Surgical correction of the tubal blockages or adhesions such as laparoscopic surgery or tubal cannulation is done. Removal or repair of the hydrosalpinx is done to improve fertility outcomes. IVF, in vitro fertilization, is often recommended if tubal function cannot be restored surgically. Treating underlying infections and endometriosis is essential to prevent progression. So, what are the treatment options? Surgical correction of tubal blockages or adhesions with the help of laparoscopic surgery or tubal cannulation, removal or repair of the hydrosalpinx, IVF, and treating underlying infections and endometriosis. In summary, dysfunctions of the fallopian tubes, including blockages due to infection or scarring, or inflammation or salpingitis, or a hydrosalpinx, or a structural anomaly, and damage from prior procedures, are leading causes of female infertility by obstructing or impairing the tubal environment necessary for fertilization and embryo transport. Medical students, what do you read about? What is hydrosalpinx and how do we repair it? Read about surgical procedures involved in correction of tubal blockages. What is IVF? What is laparoscopy with chromopertubation in treating fallopian tube dysfunctions? What are the imaging tests that can be done to diagnose fallopian tube dysfunction? What is hysterosalpingiography? What are the symptoms that patients can present with fallopian tube dysfunction? How fallopian tube dysfunction causes infertility? Likewise, please do share, watch, subscribe to my channel. Thank you. Please keep watching my videos for more updates, for more interesting updates. Thank you. Please subscribe. Thank you.